So we're going to start off today by providing a brief introduction to Shatterproof and the treatmentatlas.org website that some of you may already be familiar with. I'm going to go ahead and play a short 2-minute video so you can hear about Shatterproof's work from our founder, from people who have been impacted by the disease of addiction, and from representatives and other individuals in the states where Atlas is currently exists.
While we are rightly focusing much of our nation's energy on coronavirus, this is not the only health crisis we are battling. Unfortunately, across the nation, drug overdose deaths are rising among the coronavirus, negating much of the progress that we made over the last several years.
Dear Brian.
Dear Greg.
Michael Honey.
From the moment you were born, you were the sweetest kid.
You brought us such joy and happiness. Thank you for those 29 years.
We have a vision that our society will look this disease straight in the eye, prevent it and treat it with love and empathy, and with protocols based on science.
Many others, I lost 3 of my friends to overdose, all from the same sober living in the San Fernando Valley. And now I think, what if they had some access to something like Atlas in 2014?
This kind of database and transparency is the type of information that American families deserve to have, and they deserve to have it now.
Atlas is the first resource of its kind to help those seeking addiction treatments, helps them to find high quality care and appropriate care. It was launched in 6 states. I'm happy to say West Virginia was one of them, with the hopes expanding it to many more.
So that video obviously says it much better than any of us could. Finding addiction treatment is incredibly difficult. When you're in crisis, it's even harder than it would be if you were looking for a loved one. And there's a lot of misinformation out there. So there's no clarity around what you should be asking or looking for in a treatment facility. And that's compounded by many other challenges, many of which Shatterproof is addressing outside of this Atlas project. More than ever before, as we watch the overdose rates rising, as Senator Capito talked about, people need a place to go where they can find trusted information and treatment. And Atlas aims to fill that gap. Atlas is a one-of-a-kind addiction treatment locator. So Atlas is also an assessment and standards platform, which essentially means that we are including vetted information on how addiction treatment facilities operate in alignment with the evidence-based best practices that science shows works. Atlas allows families to navigate to care, and it also helps people understand what the experience of care has been like for others who've been seen at that facility. Atlas is different than any of the other treatment locators out there. So first, it's not funded by providers or pay to play. Atlas allows families to navigate to care that is geographically closest to them. There's no preferential sorting, as you would see when a facility pays more for ad dollars. Atlas in Florida will include inpatient, outpatient, residential, and intensive outpatient treatment. So all facilities in Florida will be invited to participate in the Atlas survey. Current treatment locators lack any information on care quality and best practices. There are a lot of them out there. It provides a starting point and identifies care that best supports long-term recovery. So if we're looking at these best practices outlined on the slide, Shatterproof derived our national principles of care from the 2016 Surgeon General's report on alcohol, drugs, and health. So we're looking at what works in addiction treatment based on decades of research. It's nothing new and novel that Shatterproof created. So you'll see whether a facility delivers personalized care, whether they provide fast access to care. You can see whether a facility focuses on long-term management of a patient, because addiction is a chronic disease. Atlas also looks at how and if facilities connect patients to primary care and mental health resources when needed, whether staff at a facility are licensed and certified, if medication-assisted treatment is offered when clinically appropriate, and finally, how a facility is addressing social determinants of health. So looking at things like access to transportation, connections to social services, providing peer recovery support, and addressing housing and other social needs. So with that very brief introduction, I promise we'll show you more of the Atlas website later, but I wanted to go ahead and turn it over to our Chief Impact Officer, Jen Vlez. Jen?
Thanks, Leah. Good afternoon, everyone. I will just say that that video never gets old. It really grounds us in the work. So I'm glad that we all had the opportunity to take a look at that this afternoon. We really couldn't overstate how appreciative we are of the opportunity to implement Atlas in Florida and work with legislative and executive branch and other leadership who are so committed to reverse the addiction crisis. And we're equally thrilled to work closely with our Florida Blue and New Directions colleagues who are so committed to quality. Dr. Dewan, your recognized expertise in behavioral health is such an incredible asset. Thanks. So I'm happy that we'll have an opportunity to work closely with you. Thanks again for this opportunity to bring Atlas to this growing number of states. You see here that the states in orange were our 6 original pilot states, and we've since expanded to the states in pink or red, I guess, pinkish red. So happy that Florida is included among them. With the inclusion of California, because it's such a large state, all told across the US population, folks, just over 40%, just a smidge over 40% of the population will have access to Atlas. And we're going to work hard to ensure that that in fact is the case. So since it launched just a year ago this month, it launched July 21st, 2020, over 110,000 people have visited this site. So this is very exciting for us. Thanks again for joining all of us, for all of you joining us today. We're really happy to be in Florida. Thanks, Leah.
Thank you so much, Jen. And I'll just echo what Jen said, that we're so excited to be in Florida. We have several speakers today that leaders in Florida that Atlas wouldn't be possible without. So without further ado, I wanted to introduce Dr. Nick Dewan, who's the Vice President of Behavioral Health for Florida Blue and a board member of New Directions. Representative Cindy Stevenson from the Florida House of Representatives over the 17th District. We also have with us from the Florida Department of Children and Families, Deputy Assistant Secretary Megan Collins. So thank you again for being here. We're going to go ahead and start by hearing from Deputy Assistant Secretary Collins. Your work is at the Department of Substance Abuse and Mental Health involves connecting individuals to mental health and behavioral health resources, ensuring they can access those services when needed. Which is obviously something we're trying to expand upon and build upon with Atlas. So can you talk a little bit about some of your work and where you see opportunities with Atlas?
Absolutely, and thank you so much. As an agency, we are absolutely thrilled whenever there's opportunity for innovation that can really contribute to our ability to connect these individuals with the right care, the right services in the right locations. Our secretary, as I mentioned before we got on the call, Siobhan Harris, has been absolutely incredible in setting a strong vision for prevention and integration, and at every opportunity ensuring that we're supporting our residents and we are making sure that they have the resources they need to prevent getting deeper into the system, because we know that that is going to ensure that they have the best possible outcomes. So we are really very grateful, very appreciative that this is happening, and that we have an opportunity to be a part of it, particularly as our state continues to grow, which we're quite proud of. We do believe that we're not only a great tourist destination, but Florida is a wonderful place to live. And so we are seeing that our population is growing. And we love that. And there are so many wonderful things that come from residents of other states moving here, making a home here. But the other thing that comes with that is we also see our numbers increase in terms of individuals that are then also in need of services, in need of care, in need of treatment. And so tools like this, resources that enable not only residents, but hospital systems to see where these available resources are, where there can be access, so that as quickly as possible, we can start stemming the tide, start addressing where we have individuals, if there's an absence of care, if they feel that it's just that there's a desire to get treatment, but they can't find it or don't even know where to start. We want to ensure that that gap is closed. And we view this as really a tremendous opportunity for our agency to partner in an innovative fashion and to really reach the people that we serve, as well as the hospital systems, so that they can really get a very clear picture of what's out there. And so the fact that it's a multifaceted approach as well, with those two entities having that type of connection in one single point of access has been something that we also feel is going to be really powerful and really helpful. And so we extend our gratitude, and we have nothing but full support. And I know that our team has provided our full list of licensed facilities and providers. And so in any way that we can continue to be supportive and to make sure that this is successful in a way that we are able to really get the best outcomes for the people of Florida, because that's the ultimate sign of success for us, is that we do keep families together and that we prevent unnecessary loss, sadness, tragedy that's affiliated every time that we lose someone, whether it's completely to addiction, or if it's just the loss of that person as we know them. We know that that is earth-shattering for families and for children, whether they're adult children or small children. And so whatever ways that we can ensure that we're supporting programs and systems and tools and resources that make sure that these individuals get the care that they need, and we have healthy and whole families in our state, is really a priority for us. And so we appreciate all of you who are on the call today and everything that has gone on behind the scenes to make this possible. And so just thank you so much. And we stand ready to continue to assist and provide information that's needed to ensure that this is a successful tool that reaches as many people as possible.
Thank you so much, Assistant Secretary. And I couldn't echo more the sentiment that this is all about the families. It's about the people who are going to be using this to connect to the facilities out there. So I think if we all stay focused on that, we've always taken a very collaborative approach with the provider community. We've implemented this, as Jen said, in 6 states already. And we're really excited to build on what we learned in those 6 states and to make Atlas even better when we bring it to Florida.
Well, we appreciate that.
Yes, and we look forward so much to working with the department to do that.
Thank you.
So Dr. Dewan, over the past few years, Florida Blue has launched a number of initiatives. I know I've read a lot about Project Opioid. These initiatives are aimed at addressing substance use disorder, and I'm curious how you see Atlas building on or complementing some of those efforts. And can you talk a little bit about that and why you think it's important for providers to participate in this?
Absolutely. Thanks again for all your efforts. As many people know, Florida Blue's been, part of the fight against this epidemic and the crisis. Back in 2017, we were the first insurer in the state that removed OxyContin from the formulary, one of the first in the country. And you're right, over the last several years, we've supported coalitions of business leaders, faith-based leaders, other leaders in communities across the state to come together to confront this epidemic. And, our foundation and Florida Blue is one of the largest funders in the state. in these initiatives, and it's really dedicated towards the people and communities in the state of Florida. I mean, our mission is to help people and communities achieve better health, and we think this completely aligns with that mission. And this collaboration with Shatterproof and New Directions is just our most recent sort of effort in this fight against addiction. And for there's over 100 of you on this conference today that are on the front lines. You're the clinicians, you're the organizations that are helping people with their lives. And for us, our support is around, can we help families and citizens of this state get an easy to use, trustworthy platform that allows them to find and get the care they need. And this Atlas system is a partnership. It's a partnership not only with the executive branch of state, the legislative branch, but all of you on this call. All of you will be providing information about who you are, what you do, how you deliver, what insurances you accept across the board. And your data is critical. Your participation, your partnership is critical. And when we can partner as a society to address what I would call the deaths and despair from any addiction, we're going to do a great thing for this state and for the society and for the neighborhoods and the families in our neighborhoods. So this is really about coming together with everybody at the table to work together. And I'm just thrilled that Florida Blue can be part of this, that New Directions can be part of this, and that Shatterproof is going to lead the way. So thank you so much for all the work you've done in the different states. And I think Florida will have the best implementation ever because we've got great people in this state. So thanks again.
I hope that is, I hope that's true, Dr. Dewan. I did want to pick up on something you said about, these coalitions you've built around the state, because so much work has already been done. And Shatterproof looks forward to being able to kind of partner with those groups, align Atlas to some of what's already happening. We definitely don't want to recreate the wheel. So we'll talk a little bit later about the advisory committee we're putting together in Florida. But I did want to mention that it's going to include a lot of those individuals that, Dr. Dewan mentioned, those coalitions and groups that have been tackling this issue from different angles. So with that, Representative Stevenson, last but not least, thank you very much for being here. I know you have a very busy schedule. You have been a huge advocate for individuals with substance use disorder. And we only met a few weeks ago, but that was very apparent to me in our conversation. I understand that you hear frequently from constituents on this issue, and that a few years ago, you passed legislation aimed at expanding access to mental health and SUD treatment. Can you talk a little bit about how this work has improved the lives of Floridians and how you see tools like Atlas continuing to increase access to care?
Well, I appreciate the opportunity to be here with you, and I appreciate all the people who are on the call and the fight. So I thank you for the opportunity to be here, and I'm really excited about what I've learned about the Shatterproof mission and what you want to bring to Florida. I've been involved in a number of bills over the years. Even just last year, I worked on a bill that was focused on getting people the right services in the right place at the right time. And so to me, it's so parallel to all the things that I guess many people are working on in their own way. But to bring services in a way that they're intelligible and accessible to people in a time of urgent need, people want to know they're making good decisions. And it is really hard in any crisis. But I think particularly in mental health or substance abuse, sometimes that there's an opportunity to get people in, where the door is open for assistance and support, and sometimes that door closes, and people, it can be really critical that they're in the right services, the right place at the right time. It's actually what I sent out on my press release for when we passed that bill in just recent sessions. I think the way I came in contact with substance abuse was, very personal. It's friends, it's constituents, and people and families that are affected. And the video that you brought us into this discussion is so appropriate, literally shattering. It affects people from all walks of life, and it just doesn't discriminate. I mean, I expect everyone has had contact with somebody, knowingly or not, that struggled with substance abuse and needed support. I am really proud of the progress we made. Some of the bills I've carried have been working closely with secretaries from our agency, DCF, and people who are professionally associated with issues and challenges. But I also, from the feedback I hear from individuals, and that it is not always easy to get into the right services at the right place at the right time, and having a roadmap, literally an atlas, to help them find their way in is very helpful. The success, of course, depends on providers engaging and being part of it as well. But I'm really grateful that you're here and that you're bringing these services to the state of Florida. And I do think that it is the kind of care people deserve. So I'm proud of the progress, and I know that we still have challenges. But I wanted to say I am so very impressed with the founder of Shatterproof, Gary Mendel, and his story. The leadership he's shown by bravely embracing the mission of overcoming stigma and helping people and family overcoming the challenges of substance use disorder. Keeping families together is a goal. And even when families have become separated, in Florida, it's a big emphasis for us to reconnect them and to strengthen those connections. So I just want to thank you for the chance to be with you today, and I'll look forward to continuing to learn more about how we can be more effective in serving the people of Florida and making each individual and each family stronger. The families that are suffering from this can be very devastating and especially at this time. So I'm very grateful. I was just delighted to make contact with you all, and I'm really encouraged and inspired by the people that have been attracted to your mission. Thank you, Leah.
Thank you, Representative Stevenson. You are out there doing the hard work in the legislature. So many of us doing so many different things to make this better for families. So
can I say the stigma piece is important too, because I know that even if the services are there, and people still have to walk through the door. So your entire mission is very helpful for us, and we're very encouraged. And thank you for all your work in the agency, and Dr. Dewan in your professional role as well. Thank you.
Yeah, I'm so glad you brought up stigma, and we're not here to talk about that work today, but I will say I'll put Jen Vlez on the spot. We have several different focuses at Shatterproof. Atlas is one important part of our work, but when it comes to stigma, that is, also a very big, we have a very big effort underway to address stigma. So, Jen, I don't know if you wanted to briefly mention that. We hope as we get to know all of you in the state that we'll be able to have conversations about those other issues too.
Yeah, I'll just briefly, because I know we are short on time, and I want to make sure we get the whole presentation in today. I think it's the biggest barrier. I think it's a shared view that oftentimes stigma is the greatest barrier for people not accessing care. And I'm glad Representative Stevenson referencing our founder, Gary Mendel, who shares often that it is not an overdose that took his son's life, rather it was a stigma associated with this disease. So we are so proud of our colleagues who are working on this evidence-based approach to reducing or eliminating stigma. They studied evidence-based approaches that reduce stigma in a number of other social movements, and now have a roadmap to reduce this. And so I know for another time, but I'm just so happy that you noted what sort of an insidious barrier stigma can be, and it's an important pillar of the rest of Shatterproof's work. So thank you for that quick opportunity.
Thank you, Jen. Okay. So I guess we've been talking about Atlas. Let's actually show you the website if you haven't seen it yet. So this is the search results page on Atlas, and you would get here after you type in your city and state on the Atlas, on the treatmentatlas.org homepage. You would arrive at these search results. Because we created Atlas to help people navigate to care that meets individual needs, when you're ready to search, you're able to filter by a lot of these factors over here on the left-hand side. So whether it's location, services, insurance, and payment options, you can select those to refine the results that you're getting. You also have this Google Maps integration where you're able to just click on a facility right on the map. As I mentioned earlier, there's no preferential sorting of facilities, other than the fact that the ones you're going to see in these search results are facilities that submitted the survey to us. So you're getting the profiles with more information in them. We do automatically filter out the ones that didn't, but there is a box you can uncheck, and come next May, you will be able to see all of the facilities in Florida, even if you wanted to look at those that had not submitted data. From the search results, you can select a facility and you'll arrive at this Atlas profile. There's a lot of information in here about who the facility serves. You can see down here, this special populations. This is really hard information to find when you're on Google and you're looking for care. You know, whether you're looking for care for a pregnant patient, a veteran, there are facilities that specialize in those, and they're just hard to get to. You'll also see, again, payment options. There's a button where you can share this profile with a friend or a loved one. You're trying to make a care decision together. Oops. And so we talked earlier about Shatterproof's national principles of care and how experts agree on certain practices that should be used in treating addiction. If we scroll down on that treatment facility profile, this is what the bottom of the profile looks like. So this has Atlas, this has information on whether facilities offer those best practices we talked about. So up here, the check mark, they offer same-day or walk-in appointments, across these various categories. And we won't get to these today, but if you're a provider listening to this, we're going to have lots of time in our monthly roundtables to talk about more of the details of what's in this. I do want to say, while we're on this page, there is no star rating or composite score. So a lot of you are probably familiar with, for example, the Leapfrog hospital rating system. Excuse me. So you'll see that they have a, they use that model. Atlas is not intended to be punitive. So instead, we are identifying areas where facilities are operating in alignment with those best practices. And we're helping to steer treatment facilities towards the best areas to target their quality improvement efforts. Further down the profile, this is the patient experience feedback section. So Atlas makes it easy for patients to leave feedback on experiences of care at the facility. This is something we heard when we did focus groups with consumers, that they want to know, they care about the evidence-based practices, but they also want to hear that personal experience piece. All patient reviews that are submitted here have to be, they go through a rigorous process where they have to meet the Atlas terms of service. We do a review that includes natural language processing software, which sounds really fancy, but essentially it's looking at, did somebody sit down and submit 10 reviews at the same time, right? 10 positive or negative reviews. And it does other things like pulling out profanity or mention of specific individuals' names. And then it also goes through a human review, and then it's posted to the website. And facilities have to have at least 20 reviews submitted before this section is going to go live on the website. Providers also have the ability to flag any patient reviews where there's a concern that they don't meet those terms of service, and Shatterproof reviews and removes those as appropriate. And that's, again, something we'll learn a little bit more about in August at the first roundtable. So as an individual uses Atlas to explore their options, they can compare up to 3 facilities side by side if you're on a computer. If you're on a phone, it's two facilities side by side. That allows them to better choose treatment that suits their individual needs. So one of the questions we get most frequently from providers is about the benefit of Atlas. We recognize that providers have a lot on your plates already. I know you do lots of reporting to the state, to payers. We don't want to contribute to that administrative burden in as much as we're able to minimize it. So we tried to design a process, based very heavily on feedback from providers in those first 6 pilot states that minimizes that burden. And then finally on this, so I want to reiterate that again, all of the treatment facilities in Florida will be listed on Atlas, but it's ultimately up to each of you to complete the Atlas survey in order to have all this information that we showed you in your profiles. Otherwise, you're going to get something that looks more like this. So this is an example of what a facility profile looks like if they don't complete the Atlas survey. So you can see the address, the location, but there's just not all that rich data that's really going to help people navigate to care. They are able to leave patient reviews. So if you're this facility who didn't submit the survey, at least people can leave feedback on their experience. I apologize, the slide's a little bit cut off here, but before we get to the Q&A session, I just wanted to highlight a few questions that we usually get. So first, how much will Atlas cost? All treatment facilities are listed on Atlas, and there's no cost to the facility, but we also don't charge the end user. So people using the website to locate care or to refer patients are never going to pay Shatterproof anything. What can I do? When can I do the Atlas survey? So you will be able to begin doing the survey in mid-October. And again, next month's provider roundtable will talk more about that process. You'll have until mid-January of 2022 to complete the survey. Finally, what happens if you don't complete the survey? So nothing happens. There are no penalties. And really in this first 6 states we did it, there were no penalties to not do it. We had over half of facilities across those 6 states complete the survey just because they wanted to get that information out there to the public. So information on the services just wouldn't be available to people. Right now it's an annual process. So, you wouldn't be able to submit your data until the next year. So feedback, we talked a lot about how this is a collaborative process. As we get closer to fall, there are several opportunities to learn more about Atlas and provide feedback. You could start emailing it today if you have thoughts. Implementing Atlas it takes a lot of people to do this and to do this effectively. So we have a few different ways that you can get us feedback and participate in the process. So first, I mentioned the Atlas Advisory Committee earlier. You're welcome to connect with advisory committee members. We'll talk more about that in the coming slides. I talked about the provider roundtables. And then finally, my contact information is at the end of this deck. So you're always welcome to reach out to me directly. I'll be the main point of contact at Shatterproof for the state of Florida. So the advisory committees, we're in the process of building this in Florida, but they will act as a conduit of feedback as we work to implement Atlas over the next 12 months. This is a multi-sector group. We have actually quite a few different constituencies in Florida. You'll see on the next slide, but treatment providers, health plans, we have advocates, community organizations, Representative Stevenson is our legislative champion, and many more. Let you take a look at the members that we've confirmed so far. So these folks are going to provide input and guidance on implementation, often because no state is, every state is very unique. We learn things and we make additions to Atlas, or we make improvements based on the experience of implementing it in a state. So we look forward to learning more about Florida and the needs there, and having that be part of our continual improvement process for Atlas. And that brings us to the timeline. So I mentioned October, just to give you kind of a view of what's happened so far. So we've been working with our partners in the state the past few months to kind of develop the plan for this. Providers will be completing the survey from October through January. We'll be supporting you with guidance. So you'll start to see emails. Feel free to opt out of them, but you will start to see emails inviting you to the roundtables, just reminding you of key milestones. Come August, we'll be verifying your contact information so we can make sure we get that survey to the right person at your facility. And then at the end of this, we will be launching the Atlas site in Florida in May of 2022. So right now, you will receive an email. If you're a provider, you will receive an email after this webinar, either tomorrow or early next week. And within that, you should have the registration information in the roundtable schedule for upcoming events. So please go ahead and register for those. You'll also have a reference copy of the survey in that email. So if you want to get an idea of what kind of information we're asking for, I mean, you've seen it in the profiles, but it's always helpful to take a look at that reference copy. Usually providers have to go to a number of individuals at the facility to gather the information. And we've heard from many facilities, especially larger ones, that it really streamlines the process of getting that survey done if they can kind of collect the answers in advance. And I think that brings us to the end of this. Just to say, if you're not a provider, thank you so much for joining today. There are so many people that will be tapping as we get closer to the launch of this website, especially individuals in the community who might want to help promote the resource and make sure the public knows that it exists. So we encourage you to go ahead and join our mailing list and stay up to date on opportunities to provide feedback or volunteer to help promote the site when we get to next spring. And I think with that, Carolyn, I think we're ready to shift over to questions. Oh, real quick, the roundtable schedule is here, but again, you'll get this in an email with those registration links. Right.
Perfect. And Leah, we have one question so far in the chat. I'll just note before asking this question that the slides and recording and the link to the video will be distributed after the event. So don't worry about taking notes. Leah, the first question is from Donald Huston or Houston, who asks, how does a treatment facility get added to Atlas?
How do you get added to Atlas? We have the list of facilities, we have contact emails, so we'll send you a link with more information on that. But we are by default adding everybody who's licensed as inpatient, outpatient, residential, and intensive outpatient in Florida. And I know we sometimes get the question about facilities that deliver telehealth. So we are including those. In our experience, they typically have an outpatient license, but if you have any specific questions about your facility, please feel free to shoot me an email and we can just confirm that that's the case.
Perfect.
Carolyn?
Yes, and then Jim Miller asks, how is this different from the SAMHSA treatment locator? So many might know as findtreatment.gov.
Yeah, that's a great question. So we have had that question quite a bit. There are a number of ways that Atlas is different. I would guess I would default to the fact that there's not quality information within the treatment locator. So you have contact information, but you're not able to see, can I get my loved one in today? Are they doing a comprehensive assessment? Are they making adjustments to treatment as needed? I mean, all of those pieces of information that really matter. And there's no patient feedback. But SAMHSA's website is great if you're just looking for, phone number, services offered.
Perfect. And then the next comment/question comes from Jennifer Webb. Jennifer says, first, you are lucky indeed to have Representative Stevenson as a legislative liaison. And I'd like to thank Florida Blue for their role in bringing Atlas and Shatterproof to Florida. Jennifer then asks, is this self-reported? If so, how is the information cross-checked? And if not, what sources of data do you utilize to populate the best practices page?
Yes, validation is always an important question. So I joined Shatterproof from the National Committee for Quality Assurance, which some of you might know accredits health plans and primary care providers. They have quality measurement programs, but this is something that we're always thinking about when you're doing some sort of quality measurement system. We built a number of validation protocols into Atlas. So when you get that survey, you'll see that you have to upload, copies of your licensure or certifications. There's information you'll have to submit screenshots of and stuff like that. And we have more information about the validation protocol on our website, so I'll be happy to include that when we send out the roundtable information.
Yeah, and then Tyler Glock asks, I noticed that you can search by insurance accepted. Will this provide in-network options first by geographical location, or will it provide the facilities with the best ratings within the region?
So I'm trying to make sure I understand that question. So there is a drop down that has different insurance plans. You know, we're starting to validate the information submitted by treatment facilities with payer and network lists, just to make sure that that's accurate for the end user. There's not any sort of, if they filtered by it, you know, if they wanted to see what, if someone took Aetna, for example, you would only see the Aetna associated plans, but unless you selected that drop down, it wouldn't, you know, show one payer over the other. Does that make sense? Or Carolyn, do you think that addresses the question?
Yeah, I would say exactly that. The only way that facilities are sorted is by geographical distance. And as Leah noted, there is no composite score on the website. So there's no way to say, I want only facilities with, say, 5 stars. Instead, it's really about showing you the quality data. And as Leah pointed out, if you filter by something, it won't show you any facilities that don't meet that filter. So if you say Aetna, it'll only show you facilities that say that they accept Aetna.
Yeah, exactly.
And then Daniel Oria asks, are there any checks being done by Shatterproof to confirm that information reported is accurate since it is self-reported by providers? How is the information kept current? Do providers have to update their survey information within a certain time frame?
Yeah, great question. So I think we answered the first part of that. In terms of updating the data, the patient reviews are submitted every 24 hours. So we review those. Those are, you know, somewhat real time. The information that we're collecting in that provider survey, it's annual right now. I will say we're looking at a model where you can submit information more frequently. You know, perhaps we will likely be able to do that at least twice a year. And then for some information, and actually I'll go back to that facility profile so I can show you. For some information, we have a password protected portal for providers. States and payers have them as well. But this information at the top, you'll be able to log in as a provider who submitted the survey, and you'll be able to edit this information whenever you need to do that. So that's true for this top portion. You know, insurance and payment information may change more frequently. But the second portion here is that quality data is on that annual, you know, potentially biannual basis.
And I'll just note, I know that we also saw, oh, great question, Daniel. I'll just note quickly, as Leah said, we have a multi-step validation protocol that's really 3 tiers to ensure that the data are accurate. The first is that during the survey's completion, we ask for certain documents to be submitted. When Leah shares the survey in follow-up, you'll see those questions that say you must submit, for example, a screenshot of your license or a de-identified screenshot of your electronic health record. Our second step is that we analyze all data and look for outliers, or responses that don't make sense. So for instance, if a respondent says that they have 2 nurses who are waivered to provide Suboxone on site, but then they say that they have 4 nurses providing Suboxone on site, that would raise a red flag, which we would investigate further. And then lastly, for a random 5% of facilities, we do a deep dive into their responses and ask them to validate more thoroughly.
Yeah, thank you so much for mentioning that, Carolyn, especially that 5%. And that's standard in other quality measurement systems to audit 5%.
Daniel Oria has a follow-up question. How is Shatterproof funded?
Great question. That definitely depends on the state. So Atlas is primarily funded by state agencies and by payers. In the first phase, we received grant funds from Robert Wood Johnson Foundation and Arnold Ventures. So the first 6 states, it was a $5 million contribution from those groups, as well as a coalition of 6 national health insurers. For Florida, we're grateful to have the support of Florida Blue in funding the project. And I will say that there's been provider concern about funding coming from payers, just ensuring that this is an objective platform. And I will say that while we're happy to have payers and state agencies and providers all working on this effort together, that they don't have a governance role in the project. Shatterproof, runs it independently.
Good point. And I'm glad to see a lot of questions coming in. This is wonderful. Tyler Glock notes, one of the large problems with SAMHSA's data is that providers commonly list more services than they actually provide in order to drive business. How do you verify the services listed are in fact offered? Currently, I do not believe SAMHSA cross-references this data with licensing organizations.
Yeah, so that depends on the specific section you're talking about. As Caroline mentioned earlier, though, we have a number of areas where you have to upload or validate data using, providing different sources to us. So I guess if you have a specific section you have a question about, we'd be able to answer it a little bit better. Unless Carolyn and Jen, you're welcome to chime in there if you have additional thoughts.
The only thing that I was going to add, Leah, thank you, is that we're always looking to automate the cross-check of information from external sources. And that's a part that we're diving into very deeply to look for anomalies or information, for example, that a provider may have submitted last year that maybe stands in stark contrast from what they've submitted this year. And we look for those anomalies and then cross-check those. So external sources and then internal cross-checks as well.
Yeah.
And I see Kathleen Roberts asks, how will this work with DCF's Resource Hub that includes providers? And for the Atlas team, I'll note that DCF's Resource Hub, which Kathleen links to, is partnered with Aunt Bertha, in case that helps provide some context for that response.
Oh, wonderful. I know, Jen, we're all fans of Aunt Bertha. I know Jen always talks about it when we're having meetings about integrating those important resources, especially around social determinants of health. But in terms of integrating with existing resources out there, that's something that's the advisory committee will play a large role in. In other states like Louisiana, for example, they have a number of helplines in addition to a state database where you can look at facilities. We don't want to duplicate efforts, but I think that our goal is to really kind of pull those pieces together. Atlas is very unique in that there really isn't anything quite like it out there. And so the Resource Hub, there's some similarities, but there are a lot of differences too. When we look at planning for the launch in May, we'll definitely consider, how can we kind of bundle together, are there text crisis lines, are there, call-in crisis lines, are there other websites that we can provide to that end user? Ultimately, we just want to get them as many resources as the best resources in one place so that they can find care.
And then Jim Miller asks, how long will the funding last in Florida?
Yeah, great question. So Atlas is usually funded, we fund it, 1 year at a time. We are looking at different long-term funding models in the various states that we're in right now. I think we anticipate, and Jen, feel free to chime in here because this is definitely your arena, but I think we anticipate that long-term Atlas funding will probably be a combination of state funding, private payer funding, and potentially grant funds. I know we're anxious to see what happens with the opioid dollars.
Mm-hmm.
Jen, I'll let you.
Yeah, no, that's exactly right, Leah. I think increasingly in the states in which we're newly implementing Atlas, we're seeing partnerships between state and payer partners, in large part because, as you noted, the states are getting increasing amounts of resources from the federal government, that this would be an appropriate use of those dollars. And that's why I think a combination of state and payer partner funding is what we're beginning to see. But you're right to note that at present time, to answer the question directly, I think it's a 1-year commitment right now. And I think the sustainability of that, I think, would be important to all of us, particularly if you see the value in Atlas.
Yeah, and I will say that our initial 6 states have all continued with Atlas using varying funding sources. So we do hope that is also the case in Florida. Carolyn, are there other questions we need to get through?
There are indeed, very popular.
Not a great group. This is great.
I think it's wonderful. So Myra Martinez Gelabert asks, you also mentioned that a consumer searching the site may be able to find where a bed may be available now. How is that information kept updated?
Oh, good question. I'm glad you asked that. And I apologize if I misspoke. So the fast access to treatment, Atlas is process structured. So you're seeing, what is a facility's policy when it comes to access or to assessments. So you can't see that there are beds available at this facility. I know there are a lot of great tools out there that do that right now. Open beds being one of them. But that's something that we have considered for the future and currently have no plans to add at this point. But we're looking forward to our individual advisory committee meetings to kind of hear, where's the need for that.
Thanks, Leah. And then Mike Cocchiola asks, if patient reviews will only show on the site once a facility obtains 20 approved reviews, what happens if a facility never gets there? You might have one facility that has high traffic and lots of engagement, while others sit at 12 reviews for years, and prospective patients never get to use those reviews to make an informed decision.
Yes, yeah, patient reviews, they're a challenge. We won't pretend that it's easy to get people to leave feedback. People are really busy, and I think it's hard. It's hard no matter what you're asking for a review from, right? I know we all get surveys in our inboxes that we never open. That being said, we're working on developing a patient experience toolkit. So that it has some best practices outlined based on our experience in the first 6 states that will really help facilities to get that threshold met.
And part of that toolkit, I'll just add, will be flyers that a facility can use with a QR code directly to your survey. So you can put those in your waiting room. And truly that patient experience survey takes maybe 5 minutes max.
Yeah, and COVID definitely posed challenges to that piece because we had provided posters and business cards and guidance to facilities on how to gather that. Carolyn or Jen, I don't know. I wish I knew how many reviews we currently had in Atlas. I want to say it's over 1,200. Does that sound right to you?
That sounds right. I don't know the count off the top of my head.
Yeah, and some facilities are really good at getting patient feedback. And so we've tried to distill, what are your top 5 tips from those facilities to try and share with the broader group. But we're all learning how to get that feedback on, some shared on their Facebook pages, others have it on their website. They, integrate it into their follow-up process. So when they send follow-up emails to patients. So lots of different ways we can, work on that.
Awesome. And we have 2 more questions left, but I invite you to add more questions if you have, and we'll respond via email. Jennifer Duncan Sanford asks, how will this work with the Blue Center for Distinction designations?
Dr. Wan shaking his head.
This is Shatterproof is an independent nonprofit entity that listens to the clinical organizations in the states they work in. And as of right now, there's no, like we said at the beginning, it's not a star rating, it's not a this rating. It is a quality, it is capturing quality information from clinical organizations so that citizens can find the care. So we try to not sort of insert ourselves into this at all.
Yeah, no, beautifully answered, Dr. Dewan. And that goes to that piece where, we are so appreciative to have funding from Florida Blue, but the payers don't have a governance role on this. I will say that, as a national organization, trying to help get to a core measure set or, key things that are important when looking for treatment, we do landscape reviews of both the measures being used in this space and, what's included in similar quality measurement programs like the Blue Distinction program. So you'll see that when you get that survey, there is a high degree of alignment with that, because we had looked at that when they were initially developing it and when we were developing our survey. And that really gets to that minimizing the burden piece. So probably information you've had to submit, other places.
Thanks, Leah and Dr. Dewan. I know we have one question left. I recognize we're at 2:59. So I wanted to see if there are any maybe closing remarks, and then Daniel, we would certainly love to follow up with your questions separately via email.
Great, actually, no closing remarks, just to say thank you so much for being here today. And I will open it up if others, Dr. Dewan, Jen, if anyone else has anything they want to say.
I just want to thank, I don't know if, I can't see if Representative Stevenson is still there or,
She is.
oh, great. All I can say is the support from the state, the support from the legislative branch. I mean, this is a transformative step for this state, and we need it. We have had a lot of suffering in terms of the scourge of addiction. And I'm so grateful for the leadership of the state to support this. So I just want to end with that, and the support of the clinical organizations that do the work to save the families of this state. So.
The perfect conclusion. Thank you everyone so much. So keep an eye out for an email in the next couple of days, and we really look forward to seeing you at that first roundtable in August. Take care.
Thanks.